Okay, we have Ben here from Revive. Thank you for coming in.
Absolutely.
And I guess we'll start with the hormone replacement therapy. But first off, where's your location at? Palm Beach Gardens, right?
Correct. So we're off of Donald Ross in Palm Beach Gardens, Alton Town Center they just built.
Really nice.
Really, really nice. Great
Yeah.
plaza.
Yeah, and I've actually been to your place, and it's very nice and clean. Everybody's nice.
Good.
It's a great place.
Appreciate it.
So would you say that out of all the people that go in there, the biggest thing that is requested is the HRT, the hormone replacement therapy?
Yeah, hormone replacement therapy really is the core of our business. It's something that's becoming more prevalent. A lot of people know about it, but a lot of people don't know about it. But it is one of those things that can benefit almost everybody.
Right. And I think a lot of people don't realize that they need it.
Mm-hmm.
And women that
Yep.
are on premenopause, menopause, and as we were talking before we started, a lot of women that were on birth control at 25, they say to themselves, well, why would I need HRT at 25? But as you were saying earlier, that birth control just throws everything off, and it can be easily corrected, but you have to accept that you need it, right?
Exactly. Yeah, I mean, we got a lot of ladies now in their, mid late 20s that have come off birth control because they do want to start having children. And being on birth control for 5, 10 plus years, those high levels of estrogen just wreak havoc on their system. They're, hormonal, they're gaining weight now, their sex drive has crashed, having issues with acne, fatigue, things of that nature. And it is easily correctable, but it's not something a primary care physician, a OBGYN, an endocrinologist is ever going to recommend to them. And the same thing with a lot of our older female patients, ladies in their 40s and even early 50s that are premenopausal or even going through menopause. They're having symptoms, hair loss, hot flashes, lack of sleep, lack of sex drive, low energy, weight gain. It's the standard
Really
systems
moody,
across,
right?
yeah, standard symptoms across the board. And again, it's not addressed by their primaries or their OBs, and they're frustrated because they know there's something wrong. They don't want to feel like that anymore. They're just not given options, and that's really where we come in with the hormone replacement therapy. Just because they're going through that change life stage doesn't mean they have to suffer through it. We can mitigate their symptoms. It just, again, it's not really, expressed as an option from a lot of primaries and OBs.
Right, because when they go into the primary care doctor and they say, hey, I'm feeling depressed, this, whatever, they'll do a blood test and they'll say, okay, well, here's Wellbutrin, an antidepressant, and here's some Klonopin to keep you calm. They don't actually address the situation, is what you're saying, where they could come to you and you could not Band-Aid it, because it sounds like the PCP is kind of Band-Aiding it, where this is correcting it so they can live happy, really.
Exactly. One of the biggest things I hear as a frustration from patients is they go to their primaries or their OBs with these issues. Hey, my hair's falling out. They do the blood panel and they look and they go, well, you're fine. And the patient knows that, again, there's something wrong. They're not fine. And that's really where we come in. We can re-examine that same blood work and go, well, yes, technically, your progesterone is in an acceptable range, but you're at the bottom 5% of what is acceptable. And, to me, I equate it to them. It's like passing a class. You could pass a class with an A plus or a C minus. A C minus student and an A plus student are in two different worlds. We don't want you to be at the C minus. We want you to be at the A plus, because the A plus means you're going to be doing better. So that's hormone optimization is a term that's used a lot. And that's really where it comes in, is to optimizing those hormones to the appropriate levels to where you don't suffer those symptoms.
And correct me if I'm wrong, a lot of times with those blood tests, they kind of like the nutrition values on, I guess that's the simplest way to put it. Like it says, eat 1,200 calories a day, 2,200 calories a day. Well, I had read or saw that that calculation was based for people that were in the military. And this was what basically the soldiers needed to stay alive. And then that led on to today. So I'm referring to that in a simple way to the blood test, where it says, okay, well, your white blood cells should be this, between this and this. Your test should be this and this. But everybody's different.
Exactly.
So that blood test is, and it gets to your point, that blood test is, say, an average of 10,000 people. Your testosterone's 300, mine's 1,100 in a bigger scale. And now this is the average, so this is what's on paper, and then this is the guideline for the blood test. But like you said, if you go in and you say, I don't feel good, I'm not feeling right. Well, it doesn't matter what the blood's, because everybody's different. And that's a big problem.
Yeah. And I get a lot of male patients, that, again, generally for males, 300 to about 900 is an acceptable range. But again, if you're at a 310, the doctor is going to go, well, you're fine. You don't need anything. But a male at 310 in their 30s, 40s, and 50s is not going to be feeling good. And you're right. Every patient is different. I have some males that feel great at a 5-600. I have some males that feel great at a 7-800, and I have males that feel great at an 11-1200. It depends on what you're looking for specifically and where you want to be. But again, it's patient specific. There is a little bit of a dialing in period because, again, we have to find out where you feel good. There's no, hey, we need to put you at a 750. That's where you need to be.
Yeah. So you kind of got to play with it a little bit, but you go in there with the sense, look, we're going to correct this by how you feel, not specifically what this blood is showing.
We like to correlate it on paper.
Yeah.
So normally certain symptoms, once we do that blood panel, we can see the root cause of those symptoms. But again, once we do that, we want to correlate it with how they're feeling. So if they're at a 900 on paper, but they're still having issues with fatigue, low libido, things of that nature, we know that that's not the good spot for them. And then same thing, I have males that at a 550, 600 that they feel too aggressive. That they want to dial it back a little bit. Hey, I want to keep it, as minimal as possible. But originally when they came in, they were at a 150 or a 200, which is an extremely low level for a male. So to put them at 1,000 wouldn't really be practical. That would be too much for them.
And not everybody that comes, I think people get the perception that people that come in that need this, oh, well, they did a bunch of steroids for a bunch of years and now they're messed up. No, there's a lot of people that are it's just not right.
Yeah.
Naturally, right?
IGF production is one of those things where, everybody has a natural IGF production level, and it's different. I'm sure you've heard of people that, can eat whatever they want, hardly ever exercise, and never gain a pound, and still, retain muscle mass. They don't seem to age as fast. Those are generally people with higher natural IGF production.
Really?
People with lower natural IGF production tend to hold on to a little bit more body fat. When they exercise, when they gain muscle, they lose it very quick. Their hair grays a little bit sooner. They don't heal from wounds as fast, or they might get a little bit sicker more often. Those generally tend to be people with lower IGF production levels. But it's what you get. You can't diet and exercise your way to higher IGF production.
Right.
What you get is what you get, and the only way to increase it is to supplement it.
And a lot of people I've noticed, and I had told some people you're coming on, is that they have a thyroid issue, but they go to their PCP, and like you said, they kind of brush it off because it's in that range on paper, but they know they have a thyroid issue because they have all the symptoms, and it's borderline.
Yeah.
Because there's a T3, T4, and then total
TSH, TA, free T3, free T4. And sometimes T3 is an issue and T4 is not. Sometimes TSH is an issue. Sometimes TA is an issue. Honestly, one of the biggest things with thyroid issues is we have to correct the dosage or the prescription from their primary. I have patients that have put on a dose of, say, 60 milligrams of Armour Thyroid from their primary 5 years ago and have never had follow-up blood work, and their dosing has never been changed. More than likely, 5 years of the same dose for a thyroid issue is not going to be appropriate. That's something you want to monitor very closely. And the goal of something like Armour Thyroid is to eventually wean the patient and then take them off of it completely.
Not keep refilling it for a decade.
Exactly.
And a lot of symptoms of the thyroid it's the same kind of thing as the testosterone. It's depression, hair loss, all that stuff.
Hair loss, weight gain, fatigue.
Yeah. And what would you say to, like you were saying earlier, like a younger woman that was on birth control that just messed her up, and she says, oh, no, testosterone's for guys, this, that, the other. What would you say to her? Would she have to stay on that for a long period of time, or could it be corrected in a short term, or like how does that work? Because I'm sure there's a ton of women out there with that, and then they're miserable and they're moody, and it's
Yeah, it's a hard thing to talk to a younger female patient about. but one of the things, the ways I guess I explained it to them is males have testosterone and estrogen. We need a certain amount of estradiol in our bodies, just like females need a certain amount of testosterone in their body. For us with the estradiol, too much is not a good thing, but too little is not a good thing either. There's a sweet spot for us. Same thing with them for the testosterone. They need a certain amount. Too much is not good, but too little can also cause many issues. And with a female patient in their late 20s, even early 30s, yes, the goal is not long-term supplementation. The goal is to get them back into a good spot where they feel healthy, they have their libido back, they have that energy back, they're not gaining weight. We don't want to put a patient at that age on testosterone therapy for the next 30 years of their life.
Yeah.
It's not, to us, it's not morally ethical. We want to correct the issue, and they still are at a young enough age to where their natural testosterone production or even their natural hormone production in general should still be adequate for them. It's just correcting the issues that birth control, that long-term birth control use caused.
So basically, you're just trying to get things jump-started again correctly and then get off.
Mm-hmm.
I mean, that's pretty admirable because I bet you if you go to 100 other clinics that are similar to yours, they will milk that. They will milk that prescription or treatment until as long as they possibly can.
Well, unfortunately, with older female patients, the decline in production is not coming back. The only way for them is supplementation. So again, if you have a female that goes through menopause in her mid-40s, there's that production of hormones is not going to magically increase post-menopause. So really, again, the only way is long-term supplementation. Same thing with males. 27, 28, our hormones, our testosterone production starts declining. It's not going to kick back up again in your 40s. So it's long-term supplementation.
It's just like taking vitamin C if that's what you take.
Yeah, but say some even younger male patients in their early and mid-20s, with them, we'll generally try to jumpstart their natural production with a natural testosterone producing protocol versus the artificial supplementation. And again, the goal there is to kickstart their natural production because it should still be at a healthy level at that age. Doesn't work, then of course we do have to go to the artificial.
And I just keep going back to the women because I got 1,000 emails.
Yeah.
They should start this at premenopause if possible, right? Now, I mean, should they wait until the menopause hits, or when they get symptoms of premenopause, do you think they should go in there to you guys and start getting that looked into?
When they start experiencing symptoms
of it, yeah.
There's not a specific point. And every lady experiences menopause different. Some ladies experience it a little bit more severely as far as the symptoms go. Some ladies have a very, very smooth transition and experience minimal symptoms.
Just look at their husband. If their husband's on a cliff, then you know that they're having a tough transition.
Exactly. But it's patient specific. If you are suffering through certain issues, again, hair loss, fatigue, weight gain, low libido, any number of different issues, if you know that there's a problem, if you don't feel the way you did 5-10 years ago, things are changing. It is time to look at hormone replacement therapy as an option to alleviate those symptoms.
And the great thing is it can all be corrected.
Exactly.
You just have to go in and do it.
Exactly.
Rather than do this dinky donkey with the PCP and you're just going to get Band-Aided and whatever kick that they're getting that month,
And I mean, honestly, sometimes too, some of these symptoms that patients experience are not necessarily a hormonal issue. It could be something as simple as a vitamin deficiency, cortisol levels. Stress is very, very high right now. Low cortisol levels will lead to fatigue, weight gain, things of that nature. So it's not necessarily, hey, we have to go straight to hormones. There's other issues it could be that are easy fixes.
How do you fix cortisol levels? And that's created when you're under a lot of stress, right? The body naturally produces the cortisone, and then how do you fix that? Or how do you correct that?
There's some different adrenal supplements that we use. We have a couple different options. One of the pharmacies we use actually has a great adrenal formula, so it is going to reduce that adrenal fatigue, help boost those cortisol levels. Now, again, cortisol, you don't want too much, but you don't want too little either. And again, with a lot of patients right now, I've seen cortisol levels that have just absolutely crashed. There's a lot of adrenal fatigue. So again, their body's not producing testosterone like it should be. That's why they're experiencing the symptoms of the fatigue and the weight gain.
And I don't think anybody thinks about cortisol like that, or at least I didn't.
Yeah, it's honestly, it's a very, very easy fix. And again, it's not a long term. Generally, within a couple months, we can get those cortisol levels corrected, and again, wean the patient off of whatever supplementation they're taking.
That's all. You guys are a beast. I like it. I like everything you're saying, you know. And then I saw Ozone Therapy. And this one I wasn't familiar with. And when I was doing my research before you came in, I mean, this is amazing. And I'm shocked that it hasn't taken off yet, because it's been around. I guess it was established in 1958, right?
Mm-hmm.
And then the late 1800s, they kind of, in so many words, kind of like approved it to be used. And then 1911 was the groundbreaker. Is that right? And then they took ozone gas and mixed it with your own blood. And then if you want to take it from there.
Yeah, ozone therapy.
Before I mess it all up.
Ozone therapy has been around for a couple hundred years now. It's very, very popular in Europe and Canada. It has been for decades. It's something that is not really well known here. I do get a lot of patients that come over from the West Coast that are a little bit more familiar with it. Functional medicine doctors are huge advocates of ozone therapy, but other than that, it's not really well known. And it is an incredible treatment. The list of benefits are a mile long, but it's a very, very simple process. There are, again, a number of different methods of administering ozone therapy. A lot of people use ozone to wash their fruits and vegetables. People use ozone to purify the air in their homes. There's, I hate to say it, but there's a rectal use of ozone therapy.
Really?
Yeah.
Is there?
I've heard that from a number of different patients.
Wow.
They do a ozone enema.
Up the
Yep.
up the behind.
Yep. Haven't done anything like that.
That's interesting.
That's kind of.
I mean, it wouldn't shock me, but
Yeah,
at this day and age,
out of our wheelhouse. But ozone, again, is great. The method we do is intravenous infusion of ozone. So we gravity drain about 60 cc's of a patient's blood, which is about a quarter pint. Not enough to make you feel wheezy or anything like that.
It's just like 2 vials, maybe? 3?
It's so we actually drain it into an empty 150 mixing bag, is what they call it.
Mm-hmm.
A little bit of saline and a little bit of heparin, very small amount of heparin to keep the blood from clotting in the bag. But once we have drained about the 60 cc's of blood, we infuse it with 60 cc's of ozone. So we actually have a machine in our clinic that converts O2, medical grade pure oxygen, into O3, which is ozone. It takes, honestly, just a couple seconds to do the conversion, but we take about 60 cc's of that ozone, infuse it into the 60 cc's of blood, lightly agitate it, and then reinfuse it into the patient over about 25, 30 minutes.
It's that quick.
Mm-hmm.
That's not bad.
And it's incredible. I love it personally, just for giving just a nice boost, healthy, refreshed feeling. It's one of those things where you get done, you just feel energized, you feel refreshed. But a lot of patients use it for mold poisonings, heavy metal poisonings.
Really?
Yeah.
Wow.
Yep.
I can't believe people don't know about this. You know, with the mold poisoning, and that's just crazy to me.
Yeah, I mean, great results with influenza A, influenza B, upper respiratory infections, asthma symptoms. It did gain a lot of traction earlier this year. Again, functional medicine doctors were advocating it left and right for treating COVID. And then there's a number of other conditions it can treat as well. UC and Crohn's have shown really, really great results
Crohn's disease?
With ozone therapy. Certain cancers have responded really well to ozone therapy treatments. But again, a number of different things you can treat with it. And I hope more people do look into it because it is an incredible therapy.
Yeah, I mean, I saw what you had on your website. Your website's amazing, by the way. So anything that we're talking about, you want to go to Ben's website because it is informative. It's as formative as NCBI. If you don't know what that is, it's as informative as anywhere you're going to research this kind of stuff, and it's all at one spot. So what's the exact website?
RevivePBG.com.
Okay, RevivePBG.com.
Correct.
And on the ozone, it slows aging, right?
Mm-hmm.
Immune system, cancer, hormone regulation, improved circulation. That's just amazing.
Yeah, it's a great immune boosting. Essentially the way it works with immune boosting and antiviral and bacterial treatments is the ozone will actually bind to the virus or bacteria in the body and rid it and cause the body to expel it.
And then does that kind of like push it through? Is that what it's doing? It's pushing pushing the blood through to where there may be a problem to kill it? Is that like a simplified way?
It's finding any foreign cells or substances that are not supposed to be in the body, and it's binding to them and then causing the body to expel them.
And it helps with decreasing the risk of cancer too? It
has been used in cancer treatments and, again, shown really, really great results. I I hate to say it, but there's just not enough research. That is the
Yeah.
biggest negative. If we could get more use in this country, we could get more research. Again, Canada, Europe, been used for decades. Really, really incredible research out of those places. But here, there's just not that much. It's still very new.
Why are they so? Is it an FDA issue? Is it a pharmaceutical issue?
We're stuck in traditional treatments. A lot of it, and again, a lot of it is geared more towards Band-Aid fixes and long-term treatments versus actually curing or correcting an issue.
So don't you say it, I'll say it. Big Pharma.
Yes. I mean, unfortunately.
Yeah.
And, again, the FDA, they are very, very stubborn. They don't like anything new. It doesn't matter how great the results look. They want 15, 20 plus years of research behind something before they'll even consider approving it as a treatment.
Is that what it is? It's something like that, right?
It is. It's
some
very
massive amount of time.
It's very, very long term. I mean, 7-8 years at the minimum. It's hard for a new drug to be pushed through, so let alone a new treatment. And even I know we're going to talk about stem cell at some point, but stem cell is something that is very predominant in a lot of other places around the world, and here is just in its infancy.
I know.
So.
And again, before we started, you were saying that not that you're for Trump, against Trump, Biden, blah, blah, because you don't want to get political, you get killed. But you were saying that Trump had said something about ozone, and this is what he was actually referring to, but it was taken out of context. And I think it'd be good for people to hear because I didn't, you taught me about what he was saying. I thought he was talking about the air purifier.
So he's not exactly the best at conveying his points,
Yeah.
but I want to say it was probably back in March. He was taking a lot of flack for talk about injecting disinfectants. But ozone therapy is actually what he was trying to refer to. And ozone therapy can be used in combination with UV light. That's one of the methods. The blood is actually circulated through a tube, which is doused in UV light to kill any bacteria in the blood. And then, of course, that blood is reinfused almost like a dialysis-type machine.
Mm-hmm.
But, yes, he was trying to convey ozone therapy when he was talking about injecting disinfectant.
Is that what he was talking about, like bleach? And then they tried to kill him over the bleach?
I think that's what it ended up.
But when this?
Yeah, when he said disinfectants, I think it somehow turned into bleach. But essentially, that's what ozone therapy is a disinfectant for the body. So it didn't come across properly and then was completely taken out of context.
Yeah, so if you haven't, look up that ozone therapy. I mean, it's awesome. I'm going to come in and do it.
Yeah,
I think it's awesome. I think before we move on to the next thing, how often for this to be like a person that doesn't have an issue, just to stay healthier and whatever, how often would you recommend this treatment be done?
For general health and wellness, 1 to 2 times a month is adequate.
Mm-hmm.
Again, if we have a patient that has a specific issue, there's different protocols for treating different issues. I don't allow a patient to do more than 2 ozones in a week because ozone actually can be harmful in too high of concentrations. It is a deadly gas. It's not something that you want to inhale. But again, 1 to 2 times a month is more than adequate.
That's adequate to get the results you're looking for. And then, like you said, it kind of depends if the patient has an underlying issue that you're treating them with, or as far as I know, I'm healthy. If it's someone like me that's just trying to stay healthier.
Well, so for mold poisoning, for instance, for mold poisoning, we'll treat once a week for 10 weeks, retest the patient, and then assess from there. So simple protocol for something like that. Again, if you have a patient that's sick, just even with something like cold or flu, we'll do an ozone therapy in combination with a high-dose vitamin C IV to help either kick the cold or flu, or to kind of get them over that hump of the severe part of it.
It's so amazing that all this stuff is out there, and it's like hidden,
Mm-hmm.
And if you don't have somebody like you to talk to, or someone like you to put on a video or an interview, you don't know that this stuff is available. And it's just amazing because, I mean, all this stuff is pretty much much safer than a drug that a doctor's gonna. I'm nothing against doctors, whatever, but the drugs that they're giving you, I mean, this is so much safer.
Yeah, I mean, truthfully, it is, and It's unfortunate that not a lot of people are aware of something even like ozone therapy. I had a patient that was in town from Oklahoma with UC, and she was having a very, very severe flare-up, and her husband had called for IV because she'd used IV vitamin therapy before back home in Oklahoma. And again, IV vitamin therapy can help replenish a patient if they're dehydrated or malnourished from the UC, but can also help alleviate some of the symptoms. But I mentioned to him about trying ozone therapy. Ozone therapy, again, shows really, really great results with the UC and Crohn's, and tried it. Called me the next day. Hey, where can I get this in Oklahoma? Do you know of any? So again, I wish it was more prevalent. I wish more people knew about it, but it's hopefully going to emerge over the next couple of years and become a new therapy for a lot of issues.
Well, hopefully you can expand to other states.
Yep.
But who knows what their guidelines are there,
Yeah.
Right? Is it different from state to state with this stuff?
I'm not aware of any restrictions on ozone therapy in the U.S. I know it's used in California a lot, and I have heard of it being used in a few different other states. So like I said, I'm not aware of any restrictions on its use.
And then stem cells that we were just referring to, I love these things, and I'm just dying to learn more about it because that's not a Band-Aid. That's a fix, right?
It's a permanent fix for a lot of issues. I've talked to patients that had stem cell procedures overseas 10 plus years ago and are still completely fixed to their issues. Again, a knee injection, for instance. You have a patient that was looking at total knee replacement, tried a stem cell injection, had incredible results. Their problem has been solved, and they no longer need the surgery. Stem cell, again, I think that's going to come out over the next probably decade as, I don't want to necessarily say a miracle, but just an incredible advancement in medicine.
And it's really good for cancer. If you can, in the U.S., if you can get it, if the U.S. has it available for a specific type of cancer, it's really great for that, right?
Yeah, I mean, a stem cell honestly can cure a number of different issues. Now, the FDA is very, very restrictive on how you can advertise stem cell. They don't like you using the word cure. They don't like you using advertising it for certain treatments. But again, diabetes, Alzheimer's, dementia, certain cancers, rheumatoid arthritis, a number of different conditions are essentially cured or remedied from the use of stem cells. And again, stem cell is something that's been used overseas for 10 plus years now. It's still very, very prevalent in a lot of countries, and a lot of people think that they do have to go overseas to get stem cell treatments. It's still in its infancy in the U.S. It's just becoming to be accepted. There was a lot of negative stigmas on stem cell for a number of years. Our stem cells are harvested from live cesarean section births. They're donated by pre-screened mothers. They're pre-screened for any defects or diseases. They're done in safe hospital environments. And the stem cells we use are harvested from the umbilical cord. So the mesenchymal stem cells in that umbilical cord have one purpose, and that is to generate a new life form. So when you take those leftover stem cells that are not used in that fetus development process, when you inject them into a patient, they still have that same purpose, and that is to generate new life or regenerate trauma or damaged tissue in the body. So that's where the term regenerative medicine comes from. So for instance, a patient with diabetes, generally that is an issue with the pancreas. The pancreas is not functioning properly. So those stem cells will find that area of trauma, which is the pancreas not functioning properly, and help regenerate that pancreas to a normal, healthy functioning level. And again, that's where it's going to alleviate those diabetic symptoms. So it might take a patient off insulin dependency. Again, rheumatoid arthritis, that is trauma in the body, and that is what those stem cells are looking for. They're looking for areas of trauma. So, for orthopedic injections, somebody with rheumatoid arthritis, to inject every small joint in the body with, say, cortisone, which is a Band-Aid, would just be an incredibly miserable process. Versus an intravenous infusion of stem cells, where again those stem cells are going to go through the entire body to seek out areas of trauma and regenerate those areas.
So basically, you inject the stem cell, and it just surfs through the bloodstream, the body, looking of where it needs to regenerate.
Looking again for areas of trauma.
That's
awesome. And then of course there are the orthopedic or the spot injections as well. Knees, hips, elbows, shoulders have been the traditional issues. or I'm sorry, not the traditional issues, but the traditional areas of treatment, which have shown really, really incredible results. Now, some of the smaller joints like wrists, necks, things of that nature, ankles are starting to be treated with great success. There's a number of different methods of infusion of stem cells. There's a number of different stem cell products available now that have different functions and purposes, but it's growing very, very quickly. It's gaining more traction now that people are starting to hear about it and hear the benefits. We're getting huge inquiries for it. So even some patients seek out stem cell infusions just for general health and well-being, for anti-aging purposes. But for somebody that is looking at, say, a knee replacement, that is a horrible, horrible process.
My mother got it done twice.
Yeah, and I'm sure you probably saw, she was laid up for, I'm sure, probably at least 2 months.
Yep.
About 6 months of rehabilitation.
Yep.
It is quite a process where an orthopedic injection of stem cells, say, into that knee joint, if there is some cartilage left, that's where those stem cells are going to go, and they're going to regenerate that cartilage in the knee joint.
So that would be like a site injection?
Correct.
So like right where the problem is, you would inject, where in other situations you would just generally infuse
mm-hmm.
and let it run through the body. So it's actually not bad for a healthy person either, just to have it run through and see what's going on in there.
And a lot of people do choose to do that. The biggest downside is the cost. Not everyone can afford to do that, unfortunately. I will say that the spot injections generally are a lot less expensive, and they are, again, very simple. One injection into a knee joint could essentially alleviate a patient's symptoms and completely take a knee replacement surgery off the table.
Just off of one dose, basically.
Yep. I mean, a lot of times issues can be corrected with one spot injection. Again, there's no downtime. We ask for light activity for about 1 to 2 weeks.
You can't beat that.
I know. The biggest thing is with a spot injection, you can't go in the ocean or the pool or take a bath for about 2 to 3 days. You can still shower.
Yeah.
You just don't want to be, have that area submerged in water for about 2 to 3 days, just because, again, there is a slight wound there from that injection into the joint.
Amazing. And does that work with like a rotator cuff issue?
If it is a partial tear, then yes. Again, that can be corrected. Unfortunately, a full tear generally will require surgery.
Even in Germany? Because, I mean, you can get more done in Germany. So if you were in Germany, could you get the right stem cell to completely repair a tear, or it's just in general it's just not going to work that way?
So one thing that is not allowed here is any manipulation of those stem cells.
I see.
In the U.S. So that's why a lot of people still do choose to go overseas. In other countries, slight manipulation of the cells is allowed. One of the things that they do is add proteins, and what those proteins do are essentially supercharge those stem cells to replicate themselves at a much higher rate than they do here. So stem cells actually replicate, they double about every 28 hours. So what they do with this cell manipulation is, again, add certain proteins in to increase that rate of reproduction. So that's what's supercharging those stem cells. But going back to the tear, if it is full tear, there's nothing for those stem cells to go in and reconnect.
I see.
If it's a partial tear, say you have a small portion hanging on, then yes, those stem cells can bring the rest of it back together and heal that tear. But really, honestly, the best way is to get an MRI, have a consultation, and see if it's a good option. Our physician is very, very good at going either, yes, I would think this would be a great option for you, or no, unfortunately, it's not going to be effective and you probably are going to need surgery.
So they could come into you and you could send them for an MRI,
mm-hmm.
have it looked over, and then make the best educated
exactly.
Recommendation possible, rather than possibly just going to, and I'm saying it, not you, then going to a PCP. It's partially torn, surgery, referral to this place, referral to this specialist, this blah, 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 blah. Next you got 17 appointments in 3 days now.
Exactly. And it does become quite expensive. And again, stem cell is quite expensive, but when you compare the cost, the downtime, it ends up being a lot less in the long run than what a patient is going to go through with either, say, an orthopedic repair or a surgery of that nature.
And how long has stem cells really been around? 'Cause they've only been over here, I think you said about a decade, right? Or like
Yeah,
playing with them for a decade.
yeah. I mean, it's really, I hate to say it, but really within about the last 3, 4, 5 years, has it become started to become accepted
In the U.S.
in the U.S. Correct. It's been a few decades now that stem cells have been used internationally. It is growing. It does take time. Medicine tends to be very, very traditional. The physicians like to go with what they know. They like to go with what they learned in med school. And if you have a physician that went to med school 30, 40 years ago,
He's stuck on that line. And the FDA, I read, is 10 to 15 years sometimes to approve anything. No matter how good it works, they will
Yeah.
stretch that out 10 to 15 years. And my opinion is that goes back to big pharma.
yeah, I mean there's a lot of pushback. Orthopedics hate stem cell because orthopedics again have made their life or their living on joint replacements. Well, if you can take joint replacements off the table in a simple spot injection, that's taken away their livelihood. Cortisone injections, again, insurance will cover cortisone injections all day, but a cortisone injection is just a Band-Aid on
Yeah.
an issue. It's not a fix. And so again, you can treat, but when it comes to the cure, they don't like to, they tend to push back on that.
My father has to get the cortisone injections. I don't know how familiar he is with the stem cells, but he's over in, the other part of Florida. And I don't know if he's still doing it. I know he was for his knee. And like you said, 3 months, you got to get it again
Yep.
and again and again. And a friend of mine, a friend of mine's wife had a really bad nerve issue in her neck. Or disc, maybe it was in the back, but or no, yeah, it was a disc in the back, but it was shooting up to her neck.
Yeah.
And I mean, she would get a gagger of cortisone, but because it was so bad, I mean, literally, she was in there every month and just really uncomfortable. But they never once, I'm reading it now, so I'm, looking at it. But I go into lunch with her many times. I'm good friends with her husband. And never once did they say, well, maybe stem cells would be a little bit better than a gagger of cortisone every month.
Yeah, I mean, generally what will happen is a patient will get cortisone injections for a period of 3, 4, 5 years. At some point, those cortisone injections are no longer going to be effective, and they're still going to have that issue. So then the doctor's going to go, okay, well, surgery is your only option.
Or here's some Oxycontin or whatever.
Pain management.
Pain management.
Yeah.
Better word to say in Florida. But yeah. And then now you have a new problem
Exactly.
on the rise.
Versus this, essential cure being on the table. Again, it's not something that a lot of people are familiar with because it's not pushed by primaries. It's not pushed by orthopedics. So there are better options out there. I tell a lot of people, hey, this is not something you're stuck with. There are options. It's just more of getting the information out there.
Right. And you think it's maybe a decade away from being more of a traditional?
I think over the next 10 years, once more research gets out there, once honestly more patient testimonials get out there, it's going to be, again, even more and more accepted. There are still some stigmas on the use of stem cell, again, because a lot of people are not familiar with it. They're not familiar how they're harvested. But once that information gets out there, I think in the next 10 years, it's going to revolutionize how we treat a lot of issues.
From reading, I think it's pretty much a miracle supplementation drug, whatever you want to call it. Is just and what it sounds like is that a lot of other companies, places, stem cells kind of got a bad rap to an extent on some issues because they didn't use the correct stem cell or they tried to go a cheaper way or whatever, and then that kind of caused a little bit of a bad rap. Am I kind of right on that?
Yeah, I mean,
or delayed the process of it being more acceptable?
Yeah, I mean, of course, not everybody does everything the right way. And there's also a few different methods of harvesting stem cells. The stem cells could be harvested from a patient specifically. So if you want to use your own stem cells can be harvested from your bone marrow, or they could be harvested from your adipose tissue or fat, essentially. But there's no advantage to that. One, it's another procedure that the patient has to endure. And two, if you have a patient that is, say, 60 years old, those stem cells are 60 years old. they're worn. There's no advantage to using those stem cells. It's actually a disadvantage to use those versus using stem cells that are brand new. And again, their only purpose is to generate that new light.
That's a great point, Ben. That's a great point, and I think that's great. And I think anybody watching this should. And I'm not just trying to push your business, but listen to what he said. He's saying to you, look, you don't want to do it that way. If a 60-year-old person's stem cells is pretty much going to be useless.
Exactly.
But if you have a younger person, which is going to go correct, that's what it's going to be.
Yeah.
And is there any real qualifications needed to get it? Like, say somebody just wants to get it once a month to stay healthy. Is there a bunch of qualifications that are needed to get that done?
As long as the patient is healthy enough for an infusion, there's no real, there's no side effects.
Okay.
Those mesenchymal stem cells, again, they are in the body already. They're already, functioning in use. So no, there's no side effects. There's no disadvantages. There's no health risk. I
think people don't realize that.
No.
That there's not really a health risk.
As long as the patient's healthy enough to receive an infusion, the only negative, the only downside with them just not being effective for whatever reason, the patient not responding.
Right, and there's nothing you can do about that. That's with anything.
Success rates in stem cell procedures tend to be about 80 to 85%, which again is incredible. Traditional medicine, generally treatments have about a 20 to 25% success rate. So, again, not everybody is going to benefit, but the vast majority of patients will. And again, unfortunately, there's no way to really assess if it is going to be effective for the patient. We can give you, odds of success, try to give you the best assessment of, yes, this will work for you, or no, we don't think this will be effective. But again, there's no guarantees in medicine.
I see these football players, tear their Achilles.
Mm-hmm.
A football player, and then he's back in 9 months. Kobe tore his. He's back. Well, I think he came back a little bit too soon and then pretty much ripped it again and everything else. But you see these injuries like an Achilles. That's a really bad injury. And then they fly over to Germany or whatever, I guess, where they can mutate things and a bunch of other stuff. And they come back, and the football is what really blows my mind. Like a running back tears his Achilles, and he's playing again by mid-season the following year, getting hit. Who's the one running back? Peterson.
Oh, Adrian Peterson?
Yeah, fast as a bullet. And he's torn it like 4 times, and the guy's back in 6 months.
Yeah, I think there's a lot of things that are used more prevalently than we're aware of. Probably a little bit use of human growth hormone.
Yeah.
A little bit use of stem cell therapy. But again, it's probably more prevalent than we're aware of. It's just not advertised.
Yeah. I guess my point is that they're getting it done with no effects, but it's a shame that they have to go to Germany or wherever they have to go to get it done, and they can't get it here. And there's not really any effect to getting it.
Yeah. It is available here. Again, a lot of patients, when we start talking about stem cell, they think that they have to go to Panama or Europe or
South.
That's
exactly what I used to think. I used to think Panama and Germany right away.
Yeah. So it is available here.
Yeah.
Unfortunately, they do have a little bit more freedom of what they can do with the stem cells in different areas, different countries than we do here, but still really, really effective, really great treatments available here.
And this is the last thing I'll kill you with the stem cells about, just because it's a personal interest of mine. There's a bunch of different kinds for different problems. Like if I have colon cancer, would you use a different stem cell for a colon issue than you would for an intestine issue?
With those two, no, not necessarily. More than likely, we would use an intravenous infusion of exosomes.
Okay.
The biggest difference would be, say, something like an orthopedic injection versus a treatment for, again, for the rheumatoid arthritis or diabetes.
Yeah.
Wharton's jelly is a very, very popular stem cell product. It's a little bit more viscous. So it tends to stay in that area better. So say you're doing a orthopedic injection into a knee.
Viscous means stays at one spot?
Little, I guess, thicker.
Okay.
A little bit more, I guess, jelly type.
Yeah.
But it stays in that area a little bit better than, say, exosomes, for instance, where the exosomes, if you injected those into the knee joint, they're going to go everywhere and try to find trauma, not necessarily just in that knee area.
I see.
So if that's the area you're looking to remedy, you want those stem cells to stay in that area. There's, hair treatments are now available. So again, generally with a hair treatment, we'll actually use about 2 to 3 different products for those.
They have a stem cell hair treatment?
Yeah.
And now is that like a site injection in your head, or?
Essentially, yes.
Wow.
So the way the treatment works for hair restoration is the stem cells actually regenerate the hair follicles to get them producing hair again.
You're gonna have a line at your door of any man, any guy is blowing a little bit.
It is a newer treatment that again has shown really, really great success, and we are getting a lot of inquiries for it. A lot of guys are really interested in it. Unfortunately, it is about 6 treatments, each about 6 to 8 weeks apart. That's generally the growth cycle of a hair follicle. But yes, the head is essentially gridded out. It's about 20 to 25 spot injections. We would do that in combination with an intravenous infusion of the exosomes, and then use a combination of about 2 different stem cell products in those spot injections.
That is awesome.
So again, it is a bit of a process, but versus a hair transplant or something of that nature.
Any side effects with the heroin? Not really.
No.
Because my friend, he was in here, and he went to a men's hair club or whatever,
Okay.
and where they slit.
Yeah.
He's got hair like I do and you do, but his is a little bit longer back here, and they took 4 or 5 slices and then put it up here.
It's an incredibly archaic process.
Yeah.
And again,
and they're going, one at a time with that. That's crazy. See, people don't know that.
I know.
I read this stuff all the time, and I didn't know that there was a stem cell for hair growth. I did not know that. And I'm telling you, Ben, I read it all the time because this stuff interests me like crazy.
There's even, ED treatments for males with use of stem cell. We use a device called a Shockwave Therapy device. It causes micro traumas to the penis, essentially creating new blood vessel growth. But that can be used in combination with stem cell for the growth factor.
And then I would assume when that happens, then it kind of opens up the pathway for the blood to flow to the penis.
Exactly.
So then you're getting the blood flow that you're not getting if you have erectile dysfunction or something like that.
Yeah, male erectile
sense.
dysfunction generally stems from 3 different issues. 1, a hormonal issue, 2, a mental or psychological issue, and then 3, issue with a blockage, blood flow.
Or all 3.
Or all 3 sometimes.
Yeah.
And we can treat 2 of the 3. We can treat the hormonal, and we can treat the blockage of the blood flow issue. But the way that's treated, again, is with something called a Shockwave Therapy device. And again, that's causing the microtraumas. It's breaking up that plaque in the blood vessels. So what it is it's increasing blood flow. It's increasing new blood vessel growth. But, again, with used in combination with stem cell increases the growth factor as well. Since you're creating those microtraumas as is, you can do a stem cell injection, and those stem cells are going to, of course, centralize in that area of trauma, but help generate.
Now, is that multiple treatments, or is that usually one and done?
It depends on the severity. If it is a severe case, we'll do a protocol of about 4 to 6 treatments. Again, the stem cell would be an add-on, essentially. Some males like to do it every 6 months. It's just kind of an enhancement, so to speak.
Yeah.
Again, some males can be remedied in 1 treatment. Some could need as much as 12 treatments. It really, again, depends on the severity. Every patient's different.
And then, like, say you do 12 treatments, is that usually kind of permanently fix it, or at least fix it for a period of time?
So it can do one of 2 things. For males that are dependent on, say, Cialis or Viagra for erectile dysfunction, it can take them off of their dependency so they're not stuck popping a pill. Or males that don't respond to Cialis and Viagra, which are the severe cases, it can help them actually be able to respond to those drugs.
Okay, so yeah, and I don't care how much it costs to get that done. I mean, even the generic Viagra is still $36 for a 50 milligram pill.
Yeah.
If you want the brand name, you're going to spend another 20 on top. And if you want 100 milligram, you better get out the checkbook. So.
Yep. And then, honestly, we see a lot of males that do it just as a little enhancement.
Yeah.
I think every guy, would say, hey, yeah, I'm not a little bit more wouldn't hurt.
I'm not going to turn it down.
So, and it can actually be used for females as well.
Really?
for females, the equivalent for females, again, is causing those microtraumas to the vaginal area, and what it's doing is, again, increasing blood flow and new blood vessel growth. So ladies that have issues with, say, sensitivity or dryness, it can help alleviate those symptoms as well.
So it makes their clitoris more sensitive.
Exactly.
Like naturally.
Exactly.
Now, does that help with their libido as well? Well, I guess if it makes it more sensitive, maybe.
Not
Yes
necessarily. So not necessarily going to help with their libido, but if sex becomes more enjoyable for them, then yes, they're probably going to want to have more of it versus, sex not exactly being an enjoyable experience.
Yeah, that makes sense. And then the other one that I'm interested in all this stuff, but the cryotherapy. Did I butcher that?
No. So
Okay.
yeah, cryotherapy. Cryotherapy is really awesome. I'm sure you have heard of athletes doing ice baths after either workouts or extended physical activity, soaking in a tub of ice water for 30, 45 minutes, even an hour. This is the new version. This is the modern version of that ice bath.
Right. So when I think of this, I think of, I used to see pictures of athletes. They're in that big steel bathtub with
Yep, the
ice.
cold tub.
Right.
Yep.
So this is the modern version of that. Is that what it is?
Exactly. So a lot of the same benefits. One, and the biggest one, is alleviating muscle soreness and fatigue. Two, alleviating joint inflammation and pain. So again, a patient that has arthritic symptoms, really great option. But there's a number of other benefits that a lot of people don't realize. One is sleep. Normally after a cryotherapy session, your sleep is incredible. You sleep like a baby. There's actually about a 500 to 800 calorie burn during and after that cryotherapy session, just from your body's response to the extreme cold.
Wow.
So that extreme cold is actually triggering a chemical response in your body. Fight or flight is really what it is.
Shooting up the metabolism to fight really the cold.
And then, of course, you have a much higher caloric burn in cold as is than warm. It increases cognitive function by increasing blood flow and circulation throughout the body. You get a nice endorphin release. So when patients come out of that cryotherapy session, they feel great. Once the cold wears off, you see, they're, oh man, I'm going to go work out and I'm going to go for a run.
They
and
get a little bit of a euphoria type of thing.
Exactly. Yeah, they come out and they just feel great. They have smiles on their face. They're happy. Yes, very euphoric.
Which then would help with any, some depression or anxiety.
Exactly.
There's a lot of anxiety right now with this whole virus. Well, in general it is. There's a ton of people with anxiety, and then they get them on, the Xanax and this and that, and then it's just...
Unfortunately, that's one of the things I've seen a lot over the last couple of months is patients depressed, a lot of anxiety, a lot of stress, just because of the events that are going on right now. And it is something that is treatable, and drugs and narcotics don't have to be used. And
that's again, the drugs are just like we've been referring to the other 4 things that we went through. They're just Band-Aids.
Yeah.
Where this is kind of more of a cleaner fix in a way.
Yeah.
And when I think of this, and you're just a book of knowledge, man. But when I think of the cryotherapy, okay, I just think, okay, well, this would be used for after a hard workout, a long run. I never, until I started researching it, because you were coming in, I never thought of it as antidepressant, anti-anxiety, relieving pain. I figured, treating migraines. That's what I wanted to ask you about. It treats migraines too?
It can.
It has the possibility to help treat people with issues with migraines.
Yeah. Again, a blood flow issue. So that's really,
that makes sense when you put it together.
Yeah. Very, very simple. It's a blood flow issue. Cryotherapy, and again, a lot of people, they see the pictures. It's a big capsule, almost like a stand-up tanning bed. Your head is exposed or out of the chamber, but it does make a lot of people nervous. They go, am I going to freeze to death or this or that? I won't lie, it gets very cold. Our machine gets to about negative 180 degrees Fahrenheit internally. The liquid nitrogen that's being pumped in is at about negative 300 degrees Fahrenheit. Ooh. So it is very, very cold. Patients do a session of anywhere from 1 to 3 minutes.
Oh, really? Based
on patient's tolerance. We'll generally start a patient at about 2 minutes and assess from there. Some patients, they do great at that. Some patients, they need a little bit longer, but generally you need a minimum of 2 minutes to alleviate any symptoms. But a lot of athletes love it as an alternative to those ice baths. Earlier this year, with the spring training, we were getting some athletes in that didn't want to do the cold tub, that they could come in, do a 2-minute cryotherapy session. They didn't have to get soaking wet. They could put their clothes on and walk right out the door.
You
and
had
go to
athletes
lunch.
coming in from spring training to your place?
Yeah, we had a couple of the baseball players that were in town. Again, where we are up in Palm Beach Gardens off of Donald Ross. We have the spring training. We have the facilities right across the street from us. So we did see a few of the players that were in town that they had done cryotherapy back home and they loved it and they found us and were coming in. Unfortunately, spring training kind of got interrupted this year.
But the point is, if they're coming to you, I mean, these guys can go anywhere they want. They know that they're getting quality with you.
Yeah.
And it's a machine. That's what you were telling me earlier, right? It's a machine. It's not, you're not jumping in a tub of water.
No. So that's why again a lot of them like it. They don't have to get soaking wet.
Yeah.
It's not a 45-minute or an hour-long process. It's a 2 to 3 minute process. And yeah, you stand in the capsule essentially. You can do
it's
it.
It's like a tanning bed, you were saying.
Yeah, like a stand-up tanning bed.
I'm going to have you send me a picture, and then when I put the video up, I'll put it in so people can see. It's not the ice thing with the ice all around you. It looks like an actual tanning bed.
It does. It looks like a stand-up tanning bed.
Sick.
It's a very, very dry cold, so you really don't shiver. It's not painful. It's not miserable. It's actually quite enjoyable for a lot of patients. And then, again, you feel great after.
And what would you say is the biggest benefit from this other than the inflammation? I mean, I know there's a lot here, but what would you say is the biggest benefit other than like recovery?
I mean, recovery, truthfully, is the biggest benefit, alleviating that muscle soreness and pain. That is by far the biggest benefit. It's why it's most widely used. But again, I mean, honestly, for increasing cognitive function and helping, boost the mood to alleviate those symptoms of depression, anxiety, things like that, it is an incredible tool.
Now, somebody who might be a little depressed, anxiety, how often would you recommend they would get this done?
I would say weekly. Again, every patient is different.
Mm-hmm.
It's one of those things that we generally say it's as needed by the patient. So when you're feeling symptoms, come in and have a session. But some patients might need it bi-weekly. Some patients might need it weekly. And some patients might be fine with one session a month.
Now, can you do too much? Like if you did it twice a week, would that be pushing it for some reason?
We require at least 48 hours in between treatments.
In between treatments, okay.
Just to err on the side of caution. We tend to err on the side of caution with everything we do.
That's the best way to do it.
Yeah.
Especially when it's somewhat new, I guess. Even though it's pretty much all right, it's just better to be on the safe side. Because you never know. Because if you got luck like me, it'll be that 1 in 10 million that something goes wrong.
There have been cases of things like frostbite with cryotherapy, and that's generally stemmed from people wanting to do multiple sessions back to back. Again, you can only tolerate that extreme cold for so long. The body can only tolerate it for so long. So to try to do 2-3 minute sessions back to back, it's just not safe.
Now the old school way in the tank. In the bathtub, I call it, the steel bathtub, weren't they going in there like 30 minutes?
It's not nearly as cold. That tub's not getting to negative 180.
What do you think that tub's at?
I mean, the water, it's ice water.
Yeah.
But again, that water is not frozen, so it's not below 32. It's probably, right around 34, 35 degrees Fahrenheit. So.
Oh, so it's not. That's like peanuts compared to this thing, right?
A little different.
But they're in there for like a half an hour, right?
But also too, this is a dry cold, so it's much more tolerable than the ice water.
Yeah, and then you have all the IV infusions.
Yep. So we have a full range of IV vitamin therapies. Everything from hangover IV, which honestly is the most immediately beneficial.
Yeah.
Which is very, very popular at our location.
Does that work right away?
Generally, for most patients, about 20
to 30 minutes. Is that the feedback
minutes.
That you get?
Yeah, I mean, about 20 to 30 minutes. I've seen patients go from, I hate to say it, but, throwing up in a trash can and, barely being able to function to 30 minutes later feeling great and, I'm going to go do this and I'm going to go do that.
You're going to have a line of alcoholics on one side and you're going to have a line of guys with no hair on the other side.
Exactly. Hey, I'll take it.
Yeah.
But yeah, I mean, immune boosting IVs, energy boosting IVs. Then we have some more specific IVs, like a chelation or a detox IV, which is a pretty substantial detox. We use that it's not a recreational detox. It is again, trying to remove some sort of foreign substance.
Yeah, that's what I was going to ask you. You have it on there as the detox. You're not referring to detoxing off of drugs. You're referring to detoxing. Maybe you're eating bad. In that sense,
Even
right?
more than that. Generally,
Okay.
if there's some sort of blood poisoning or toxicity, that's really where it will be used. I again, I get a lot of patients that inquire, they had a big week drinking or weekend drinking, for instance, and then, they want to detox their body. That is not what that is used for. We do have certain things that we would use for that.
Yeah.
And again, as far as detoxing off of a drug addiction, we do have a therapy for that as well, NAD therapy.
Do you?
NAD IV. So NAD is another compound that's emerged in IV therapy that is essentially an anti-aging chemical. NAD is something that the body naturally produces. As we age, production declines. But NAD therapy can actually be used to wean patients off of addictions. There's protocols for opioid addictions. There's protocols for alcohol, tobacco, caffeine addictions, a number of different substances.
So it kind of it helps deal with the withdrawal.
Exactly. It minimizes the withdrawal symptoms.
Wow.
But it can also be used to boost cognitive function. It's used a lot in dementia and Alzheimer's patients. It can be used to boost the metabolism. It can be used for muscle recovery. There's a number of different benefits. But again, it's something that's emerging, that's becoming a little bit more prevalent. Any patient that inquires about NAD, I just tell them, hey, honestly, Google it. You're going to see tons and tons of great information regarding NAD. But that is a therapy we have as well.
And is that what you call it, NAD?
NAD.
Okay.
I don't think I have any information about it on the website. It's something new that we introduced about 2 months ago.
Did you? I think that'd be big and help a lot of people.
Yeah. It's definitely something that's emerging. But again, we have IVs to help diabetics, ward up neuropathy. The immune boosting, the energy boosting are generally our most popular IVs. I always recommend for new patients to try an energy IV as their first one and then assess. But we can also customize IVs as well to suit patients' needs specifically.
Does the energy one hit right away?
Normally the next day.
The next day?
Yeah, it does take a little bit of time for your body to process those vitamins.
Mm-hmm.
But generally patients feel best the next day and the following days after that.
Okay. And I wanted to ask you, what is the Glamour one? I'm sure you get asked that quite a bit.
We do a lot of that. So the Glamour IV has a compound in it to actually help boost collagen production.
Oh boy! Now you're gonna have bald guys, alcoholics, and a bunch of women.
Very, very popular with the ladies. They love that Glamour IV. It helps clear up the skin a little bit.
Really?
If there's any issues with like acne or a little discoloration, it'll give you a little bit of a glow. But that's the glutathione that we use. But also there's the glycine in it, which again helps stimulate collagen production.
Wow, that's awesome.
So
that's gonna blow up.
Yeah. It's been very popular.
And then again, I don't mean that's the same thing, but now does that take a while to hit?
Again, yes. Most vitamins do take a few days for your body to actually process them and metabolize them properly. So it does happen over a period of time. It's not an immediate. You do the infusion and you look 10 years younger.
Yeah, right.
We're not that magical. But it does, it's something that happens over a period of time.
Wow, okay. And then there's a weight loss one that you do, right?
So the weight loss IV is essentially geared to boost a patient's metabolism. Again, it's not a miracle. It's not something that you're going to do and lose 5 or 10 pounds overnight. But it's geared towards boosting the patient's metabolism, which, of course, is going to help them burn a little bit of body fat.
And that's kind of like maybe a hit or miss?
It's something that, of course, is not a bad idea. Now, with our patients, if weight loss is their main goal or a concern of theirs, one of the things I always recommend is blood work. So then we can really determine the root cause of that weight gain or why they're having issues losing that weight and assess it from there.
So then referring back to the HRT, if you have a thyroid issue or another blood issue, you can come in and get this weight loss IV for 97 days in a row. It's not going to do anything
for you, yeah.
Now, if you're pretty cleared up and your blood's good, this is going to give you a boost.
Exactly.
Is what you're saying.
I like to use it a lot for patients that, are dieting properly, exercising properly, and just need a little bit of an enhancement.
Yeah.
If there is an actual issue that is causing, weight gain, such as a thyroid issue, a hormonal issue, a vitamin deficiency, we're going to have to address that separately.
And refer back to the HRT.
Exactly.
Other than the hangover one and the Glamour one, what would you say is the most popular right now?
Energy IV by far.
Really?
The immune boosting IV was definitely very, very popular over the last couple of months. But the energy IV is our most popular.
Is number one, yeah.
Yeah.
And then how does the gut one work?
So again, just kind of helping the digestive process. Vitamin C is actually really, really good for gut health.
Really?
For helping to rid. So of course, in your gut, you need good bacteria, but there generally is bad bacteria as well. Well, we want to get rid of the bad bacteria. So the high dose vitamin C can actually help with that and just improve your digestive system.
So maybe if you're getting a lot of indigestion, it might be something to
Indigestion,
consider.
a little bit of an upset stomach,
Acid
things
reflux?
of that. Yep, acid reflux, things of that nature. Any sort of intestinal discomfort. But again, if it is a more severe issue, we do have treatments available, such as the ozone therapy. The ozone therapy is great for, like I had mentioned, the UC and the Crohn's.
You got a one-stop shop there. That's awesome. I mean, you even have more. And you have package deals on this?
We do packages on the IVs. So for all new patients, we do $99 for their first IV. And then, of course, we have some packages available as well.
And by the way, that's a good price because I've been to other ones, and that's a pretty good price.
Yeah.
So, like, if you wanted to come in 4 times a month, you could get a package deal and get some savings on it.
Correct. Yeah, we have the packages available. We have some IV memberships available based on frequency. So a lot of different options. Again, the reason I do the $99 is this is new for a lot of patients. They're not familiar with it. So I want to make it, something that they can introduce themselves to, hopefully have a good experience, enjoy it, and come back on a regular basis.
Yeah, you make it affordable and say, look, it's $99. Try it. If you like it, we'll see you soon. And there's probably a good chance that they're going to like it. But like you said, it's a new thing. Some people are scared of it. I know people that were scared of it, that were kind of,
yeah.
But then they ended up going and getting it done, and now they're there every other week.
Yeah. I do. I have a lot of those patients that, for instance, everybody hates needles. Nobody likes getting a needle put in them, and I do have some patients, again, that initially were terrified of getting a needle put in their arm, and now are in on a weekly basis because they saw the benefits, they know how they feel, they're hooked.
Right.
So.
And I want to make this clear to anybody that argued with me about it. These are all insulin needles that are used, or am I wrong?
It's not an insulin needle, so it's a.
I shouldn't say insulin needle. It's a thin needle. It's not like some big.
It is. It's a very, very small needle that's inserted. It's actually a catheter. A very small catheter is really what is inserted. So it's plastic. It's bendable. It is a small gauge. We use generally either a 20 or a 22 gauge, which is on the smaller side. But truth be told, it is completely painless.
Yeah.
It is completely painless. There's no discomfort or anything like that. So again, once patients do it once or twice and they become comfortable with it, it's more of that thought that really freaks people out.
Yeah.
So
Ben's the king here. He knows all the technical terms, but to me, it looks like an insulin needle. So to me, it doesn't look any different, and it's just that pinch for a second, and then that's it.
If that. And I'm fortunate. I have a great nurse. Most patients honestly told me that they didn't even know that she inserted that.
Yeah, black and blue marks when you went home.
Yeah, most of my patients don't even know she did. They look away and it's done with. They go, "Oh wow, that was easy."
Yeah, right.
Yep.
Yeah.
So,
and then you also do Botox.
We do injectables. We do Botox. We do filler procedures. Of course, everybody knows Botox. It's very, very prevalent. Same thing, fillers as well. But fillers are not necessarily just lip fillers. You can do cheek fillers, jawline fillers, things of that nature. There's a number of different procedures available. We do, jaw sculpting with fillers, for instance.
Yeah, my friend went down before you guys years ago. He went down to Miami and he got they do the jawline. Mm-hmm. It's I forget what it's called that they use.
I'm gonna kick myself. I can't.
It's not it's not the one that starts with an R.
It's
Juvederm maybe. I think it's harder.
Juvederm is one of the brands, and they have a number of different products.
I'm drawing a blank too.
I know. I'm gonna kick myself.
I had just talked to him, and I said, "How's your jawline doing?" Because I was asking him how long it lasted. Damn it, I can't remember which one it is.
It's not it's not Restylane.
No, it's not Restylane. It's the other one. They got the Juvederm. the wrestling. Well,
I'm gonna kick myself
Yeah,
because
well-
I have a couple boxes of it stacked in the office
yeah,
right
you know
now.
what's gonna happen is we're gonna walk out of here and it's gonna be
Exactly.
like that.
Exactly.
Now, does that actually? I mean, I've seen them, but you know, I don't know. I went down to Miami. I don't. You know, I think just by sitting across from you, I'm pretty sure that your people would do a much better job.
I hope so.
So now, because I know a lot of women want it. So now that sculpts your jawline.
Sculptra is the product that's used. There we go.
Yeah.
Sculptra.
Sculptra. We're talking about sculpting. We can't even think of the name Sculptra.
But yes, it helps sculpt the jawline. The other really nice thing about it is it actually lasts a lot longer than, say, a traditional lip filler product would. You know, lip fillers, every patient, again, is different. It depends on how fast the body metabolizes that product. But for most ladies, it's in about 3 to 6 months. The Sculptra, the jawline filler, will actually last about 2 to 3 years.
Now, do you look all deformed right after you get that done?
No. So, of course, you know, one of the advantages to having a great physician is they essentially do sculpt that product in a nice, smooth pattern. Again, same thing, you know, with lip filler. When lip filler is done, no, it shouldn't look lumpy and you know, and not shaped properly. It'd be smooth, even, distributed throughout the lip. So, exact same concept.
So you do lip filler.
We do
lip filler,
Yeah, we do.
sculpture. What's it called when they shoot filler?
Yeah, cheek filler. I mean, there's a number of different filler procedures that can be used. It goes down to the quality of the injector. So the injector we use is an MD. This is his background. It's what he's been doing for a number of years. You know, again, some places, you know, will have an esthetician doing lip fillers, and you might not necessarily get the same quality injector of an injector.
Right. Well, I had seen my friend who got the sculptor done after in Miami, and when I tell you he looked deformed, I mean, I probably, if I was him, I don't think I would leave my house for probably like a week because you could see like the line. I mean, it was pretty rough.
I mean, unfortunately, not all injectors are created equally. But it goes with anything. You know, there's a number of different artists out there, and some artists are just better than others. You know, unfortunately, and that's really, you know, what you're looking at.
And I had migraines. I had migraines where, not all the time, but I had really bad vision from far away. I was 1,120. I was legally blind from far away. I just missed the cutoff to get the laser surgery, and I went to Baskin Palmer out there on PGA. But even now, I used to really get them to the point where I got tunnel vision, and then I started getting Botox.
Yeah.
One, to look younger. Yes,
Of course.
absolutely, and I'm going to take it to the day I
Yeah.
die. I don't care. I'm going to look younger. I'll take 80 units, and if that thing doesn't have 80 units in it, put 80 units
Yeah.
in it, you know? But it really does help with the migraines.
Migraines, and TMJ is another one.
What's TMJ?
So lockjaw, essentially. So when you know, when patients have a tightening of the jaw muscles, and they have either like a clicking or you know, a hard time opening and closing their jaw.
Oh, when you're around one of your boys and they're doing this, and you can hear it pop all the time?
Yeah, exactly. So Botox can be used for TMJ as well. Not a lot of people are familiar with that one either.
No, yeah, because I've heard many of my friends over the years, they'll do this, and you can hear the thing pop.
Yeah, a lot of people have issues with it when they sleep.
Oh, like so would that help with like when you grind?
No, not necessarily, because that's more of a I hate to say it, but a psychological reflex.
Yeah, they got to put a mouthpiece in sometimes.
Yeah, because they grind their teeth. But it happens a lot when patients, when they sleep, they go in the morning, they go to open their mouth and it's stuck.
Yeah.
So.
And how long is Botox supposed to last? Now I've gotten it done forever, and we'll get it done forever. But how long is it actually supposed to last? I know they say a year and this and that.
Yeah.
But like for me, I go in the sauna all the time, right? So I run with a sweatshirt on, a bodysuit. I'm drenched, and then I go in the sauna for 30 minutes, and it's an infrared sauna. I go in there for 30 minutes at 140, 150. So for me, I only get 3 or 4 months out of it. Now, when I went to my physician who was doing it, his answer to me was, well, you know, you're in the sauna. There's effects to it.
Yeah, every patient is different. How fast they metabolize it. There's no So one thing so Botox, and again, not a lot of people are really familiar with this. Botox is a brand of a neurotoxin. I guess with, say, tissues, for instance, Kleenex is what a lot of people say because Kleenex is the most widely known brand of tissues. Well, same thing with neurotoxins. Botox is the most widely known brand of neurotoxins, but there's actually a few different available. Dysport, Xeomin are some of the more well-known ones. There's a couple new products coming onto the market. But every time a new neurotoxin comes out on the market, we last 8 months, we last 9 months, we last 10 months. But truthfully, it really depends on the patient. So a patient that is more active is going to metabolize that neurotoxin faster than somebody that is a little bit more sedentary. For somebody that's active, 3, 4, 5 months is typical, but very, very rarely do we see neurotoxins being effective beyond 6 months. Again, every time a new product comes out, they tell you they last
swear
this
up and
long,
down,
and it never actually happens. For instance, with gas mileage, a lot of, when you buy a car, they'll tell you get 25 miles per gallon. You never get 25. It's downhill in perfect conditions,
right?
With a strong wind behind.
So they're saying, so when they give you the 12 month or the 10 months of Botox, that's if you sit in your couch, don't move, have somebody bring you your food, don't sweat,
Yeah, that is under perfect conditions.
Yeah.
So.
But I mean, it really does work, and it's so much better than going and getting surgery and everything. You can just avoid all that.
Yeah.
And even now with like you were saying with the fillers and everything, you can pretty much get like a non-surgical facelift with the combination of, correct me if I'm wrong, the combination of the Botox, the fillers, everything you have, unless you're really bad.
You can even use stem cell.
Really?
You can even use stem cell for a facelift. Again, regenerating the cartilage,
and that's
tightening
no
everything.
Cutting.
No cutting. Yeah, non-surgical facelift. Again, it is not it's not a cheap option, but if you're looking at it, stuck between a surgical facelift, just like you would be stuck between orthopedic surgery and stem cell is going to be a lot easier, more effective procedure. Yeah.
Because you got to think, you want to get. Just me personally, because you're going to have a scar of some sort.
Yeah.
It's just freaky to me.
It's going to be a very, very, very traumatic experience for the body.
And then it's got to heal.
Yep. There are a lot of recovery time. So, again, much, much better option that not a lot of people know is available.
Wow, you got some killer stuff, man.
Yeah.
I didn't know you had all this. I knew you had a lot of it, but, the lip injections, I didn't know you had that. And I didn't know that it was supposed to. I didn't know that after you get, and any woman watching this is going to be like, what? That when you walk out, it shouldn't be one here, like a bubble here, bubble here, bubble here.
Yeah, the goal is
to
smooth.
walk out even. Now
exactly.
It's going to go down over time.
Yeah, you're going to have a little bit of swelling initially for the first couple of days. Even the best injector is occasionally going to leave a bruise.
Yeah.
But generally, you want them smooth and even from the get go.
That's. You are a one-stop shop.
We have a lot of great services available. And that's really one cool thing about us and why we have great patient retention is we get a patient that comes in for one service and they learn about some of our other services and then they grow into a long-term patient for multiple reasons.
Yeah, they kind of break the ice and then they see what else and the benefits and how clean it is and the quality of product. I think, and I'm saying it, is that the quality of product that you're using sounds like it's so good that you do one thing and maybe you went to place A and you didn't get the greatest results, but because you seem very big on quality, and I've been around other people that have clinics and all this other stuff, but I've never. I think you're the most knowledgeable and careful person who owns these clinics that I've been around, because remember I was saying I was looking into one.
Yeah.
And I had a medical director come down and this and that, and I had a lot of meetings, and I didn't have time. It's a long story, but if you've done it before somewhere else, $99 you can go in there, do it once. If you don't like it, okay, don't come back. But it might change your attitude about a lot of it. I know my attitude's changed.
Absolutely.
I'm gonna go play around in there.
Absolutely. Yeah, it's one thing I've said from the get-go for us is there's a lot of clinics and facilities that do similar services and things that are like us. my goal is nobody does it as well as we do. Nobody has a variety of services that we do. I want to be the best at what we do, and everything in our industry has to be done safely and by the book. We're treating patients. We're not seeing customers, and that's a big difference to me. We have the ability to treat patients with severe medical issues, and we have the ability to help patients increase their quality of life and everywhere in between. So that is a very significant thing for us.
So you guys are looking at it not as a sale, more as a patient, and how can we help you the best that we can?
Exactly.
Where I think I think probably 80% of your industry is more looking at the sale rather than the patient and the quality and everything else.
I'd much rather take care of people,
right?
Because again, our patient retention is incredible. Our referrals
and that
are incredible.
Proves it right there.
I get ladies that bring their husbands in. I get mothers that bring their children in. We get people that bring their friends in. I've had patients drive to our clinic from different parts of the state that have 100 options between us and them, but they want to come to us because they have a friend that comes to us and refer them, and they want that same experience.
Well, just like I was saying, you're getting these athletes coming in there. They got 200 places to go, so if they're coming to you, you're doing something right.
Yeah, I mean, I had a patient last week drive up from Miami. I have one that drives up from Coconut Creek every week. There's 100 clinics in between us and them that they could go to.
And for people that don't know, from Miami to Palm Beach Gardens, depending on what time, it could be a 2-hour drive.
Yeah, hour and a half, 2-hour drive.
And along that way from Miami to Palm Beach Gardens, there's about probably 300 clinics.
Easily.
Easily. And they choose to go to you. So, I mean, that's saying something.
I had 2 patients in the same week drive down from Orlando. And again, there's a number of different options between us and them. But they wanted to come see us, so that means a lot to me.
Yeah, that's awesome, Ben. I think you're doing a great thing. I think you're just going to get bigger and bigger and bigger. Is there anything else like you're looking forward to in the future to adding, or are you kind of sticking with what you got right now and gonna play with that before you get any more toys? Or
I want to stick to what we do well.
Mm-hmm.
One thing. You don't want to do too much because then you're not really good at any one thing in particular.
Mm-hmm.
So I know it does seem like we have a lot of services, but we do have essentially our 5 core services, and that's what I want to stick to and do those better than anybody else. The biggest thing for me is just, to grow and expand. There's a lot of potential for us. There's a lot of opportunity. Again, I love hearing the patient stories, of how we've helped them, and that's the most rewarding thing for us is to take care of people and just see it grow.
And what's awesome is you're basically saying, look, this is what we know. This
Mm-hmm.
is what we do well.
Yeah.
I'm not going to be greedy,
Yeah.
In so many words. And we're going to stick with what we have and perfect it the best we can.
Exactly.
And if something pops up along the way that we think is worth it, maybe we'll add it. But right now, this is what we're good at.
Exactly.
This is what people are happy with. We know it works. There's not a lot of issues or anything like that. So, again, it's Revive.
Mm-hmm.
And just call in, make an appointment?
Yeah.
I saw on Facebook you can actually do it on Facebook, right?
We don't have appointments online, but we do have a couple different vouchers available that are on Facebook. The best resource is our website, revivepbg.com, for some information. But honestly, best thing to do to make an appointment is just give us a call. Our main office number is 561-437-7753.
And that's 5320 Donald Ross Road, Suite 125, Palm Beach Gardens, Florida. You said you're closed on Wednesdays and Sundays.
Wednesdays and Sundays, yep. So we're open Monday, Tuesday, Thursday, Friday, Saturday, right off of Donald Ross in that new Alton Town Center they just built. It is beautiful.
And you do have a Facebook.
We do.
Have a Facebook page.
Yep.
I'm going to put this up when we do it. And I love that logo, by the way.
Thank you.
And you can see a lot of the stuff on
some
Facebook.
of our staff.
Yeah, that's awesome. Got a lot of stuff going on here.
Yeah.
Is that right here? That's
the cryo. Yep.
That's the cryo. That's what we were talking about. So, for people looking at this is what used to be the ice tank.
Yes.
And that's that's what's used now, right?
Exactly. So you can't see it in the picture, but there is a door that closes. The hole in the top, of course, is where your head sticks out. But the back of the machine where the kind of wrinkled padding is,
Yeah.
so the nitrogen vapors actually come through there. So the liquid nitrogen, of course, never touches the patient. It's just cooling the tank internally.
That's so awesome.
But it's honestly, again, it's a little scary for certain people,
Yeah.
but once they do it, they fall in love with it.
Yeah. I mean, and this is his this is your website,
Yes.
and if you want, you go up to services, and believe me, you can click on services, and it's very informative. It's written well. It's not written in extreme difficult terms to comprehend. It's very easy to read and understand, and it'll blow your mind. We would be here for 10 hours going through everything, the literature of it. But you can go on there within an hour. You can really read up on what you have. And Ben's this is my first time meeting you in person. He's a very generous guy, very nice guy, and I'm sure that you'd be more than willing to explain anything. And I'm sure you have staff around you that would do the same if they have questions.
I mean, I'm more than happy to meet with a patient and talk to him for however long it takes to, explain our services, how we can benefit them. Again, a lot of this stuff is not very well known. It's not understood as, how it can benefit a patient specifically. So that's what I do the majority of the day is explain what we do, how it can benefit patients, the services we have available. If you have a question about a service specifically, we do have the inquiry right here on the homepage.
Yeah.
So you could submit your name, phone number, and email, and then which service you're interested in. And we have somebody get back to you within about 24 hours that can give you a little bit more information about that service.
Right. So you could go, and as you can see, you can click on which one don't you have up here?
I don't have so stem cell is regenerative medicine.
Yeah.
And if you do click on regenerative medicine, it will talk a little bit about more stem cell.
It does, yeah.
But that is the appropriate term for stem cell is regenerative medicine. I don't have the fillers up there as far as an inquiry, but again, it is something that we have available.
But you could probably put that under Botox, right?
Yeah.
Yeah, if you want to. Yeah, I'm just, just the case.
That's what most patients do.
Yeah, I would assume.
I do have a little bit more I want to add to the website. I don't want to overwhelm people and have too much that they get lost in it.
It is clean and easy to use, and I agree with you. Maybe just put Botox filler / filler, you know what I mean?
Exactly.
But, so definitely go out there. It's a great place. I'll put all in the description of this video. I'll put the address, phone number, contact, everything like that, the Facebook, whatever. Ben's a great guy. I think you're going to be off the hook successful. And, I just hope this information gets out there more and more and more, because that's the problem.
Yeah.
Is that it's just not out there yet.
No, I again, I've had patients from other parts of the U.S. One of our patients here locally referred their brother that lives out in the state of Washington because she knew that it could benefit him, and there was just nothing available anywhere where they lived. Hopefully this becomes more prevalent, more people get exposed to it, and how it can benefit them.
Yeah, awesome. Well, thank you for your time, Ben. I really appreciate it.
I appreciate it.
I hope to have you back.
Absolutely.
All right. Thank you, Ben.
Thank you.